And even if you have to go for IVF, chances are high that you will now probably require the donor eggs.
Hello everyone, you're welcome to another episode of Fertility Expo Room. My name is Priscilla Sawe, and today we shall be discussing a very vital topic, which is secondary infertility. Many people assume that after having a child, getting pregnant again would be easy, but that's not always the case. To help us understand why, we are joined by our specialist, Dr. Eronmosele. Thank you, Doctor, for always joining us. Now, to start us off, could you please explain to us what secondary infertility is and how it differs from primary infertility?
Secondary infertility actually means that, look, this couple had achieved pregnancy before. Okay, they probably had a pregnancy that, as a matter of fact, may not have ended up in live birth. Okay, but they had achieved pregnancy before. Either that there is a baby, live baby, dead baby, they had miscarriage or stillbirth. But this woman had been pregnant. But subsequently, is unable to achieve pregnancy. Now, when a couple have had frequent unprotected sexual intercourse for over a period of 1 year, with the desire to get pregnant and it is not achieved, such couple is said to be infertile, subfertile or infertile. Now, in a situation whereby this woman had been pregnant before, we call it secondary infertility. Or like a situation where some women will tell you that, oh, I have never been pregnant since I was born. Okay, when a woman had never achieved pregnancy before, we say it's primary infertility. This is the major difference between primary and secondary infertility.
That takes us to the next question, Doctor. What would you say are some of the known contributing factors to secondary infertility?
Now, what are the contributory factors to secondary infertility? A woman that had been pregnant before, how come she can no longer, with the same man, how come she can no longer achieve pregnancy going forward? Now, there are certain factors, that are quite known to contribute to this. For instance, a woman that had delivered through cesarean section before, probably in the process of the healing of this surgical incision, from the surgery, healing from, you have scars. These scars can block the tubes, and subsequently, this woman will have difficulty achieving pregnancy. Okay, and the husband equally could have had infection of the testes. Okay, a situation that may now lead to low semen, poor semen parameters. Okay, and subsequently going forward, this man may not be able to get the wife pregnant. Okay, these are the all these couple now got infected. Infection of the genital tract, okay, can lead to secondary infertility. If for whatever reason we have endocrine issues, this couple now have hormonal imbalance, okay, for whatever reason, it can also lead to secondary infertility.
Now, Doctor, we hear of so many couples who struggle to conceive again after having a child. When do you think or advise they seek medical help?
When should this couple seek medical advice? Of course, like we always say, if after trying for 1 year you're unable to achieve pregnancy, you should see your gynecologist. And of course, you will now have to be evaluated. You will run tests to know the cause. Is it that you have hormonal issues? Is your prolactin now very high? Okay, for those who have high prolactin, and because of that, they are unable, the couple Why, if the woman is unable to ovulate, okay, there are medications for that. So the cause of the problem must be investigated. And once that is found out, the problem is already half solved. Now it is to now the 50%, the remaining 50% will not have to do with going for the recommended treatment for such a condition. Okay, like I said, if it is hyperprolactinemia, your prolactin is very high, there are already medications that can address that. Okay, if this patient, for instance, now has a polycystic ovarian syndrome, of course, there's reason for that. If for whatever reason this person has premature ovarian failure, of course, that can also be looked into and the necessary treatment modality applied. Okay, so if I was to advise you, you're trying, maybe you had one baby, this baby is, because we see many patients coming around. They said, I've only delivered once, I've only been pregnant once. And baby is 13 years. Why are you waiting for 13 years? By then, you would have probably exhausted all your eggs. Okay? You had your first baby at the age of 30, for instance. And now you waited for 13 years, you are now 43. Yeah, it becomes more difficult to get pregnant spontaneously. And even if you have to go for IVF, chances are high that you will now probably require the donor eggs to get pregnant.
Then, lastly, doctor, for a woman who has been trying to conceive again, is there any natural way for her to get pregnant?
First, before you try to help yourself naturally, you have to be evaluated. You have to see your gynecologist. Okay. After evaluation, you will now see, okay, whether there is natural remedy, whether there is a chance that you could spontaneously get pregnant. Most of the time, you actually need some assistance. Okay, that is why the other name we have for IVF is assisted reproductive technique. Assisted reproductive technique. You may most of the time need assistance. Either that, okay, you are going to have medications for hyperprolactinemia, or that you are not ovulating for whatever reason. The commonest cause of that is polycystic ovarian disease, now known as, instead of PCOS, now known as polyendocrine metabolic ovarian syndrome. Okay, we have to know the cause before. For instance, I saw a couple. They have been pregnant. I mean, they have been married for 15 years, and the woman was busy taking native medications for good 15 years. After evaluating them, we discovered that the woman had no problem. The only problem was that the husband had zero sperm count. It was not possible under the earth for such a couple to achieve pregnancy. You have to know the cause. The reason why I believe that native medication cannot help a couple who are desirous of getting pregnant when it is evident that there is a challenge.
And that brings us to the end of today's episode. A very big thank you to our guest, Dr. Eronmosele Uyo, for taking the time to educate us on secondary infertility. Thank you, viewers, for joining us. We do hope you've learned something useful. If there's any topic you would like us to cover next, kindly drop it in the comment section. My name again remains Priscilla Sawe. Join us in our next episode. Until then, stay blessed, stay hopeful.